All right, so today we're going to dive deep into the world of healthcare. CVS Health just had their earnings call, and, well, let's just say it was interesting.
Definitely not your typical earnings call. A lot to unpack here, especially if you're interested in where healthcare is headed.
For sure. I mean, CVS is trying to be like this one-stop shop for everything health, right?
Yeah.
Prescriptions, insurance, even doctor's appointments. They've got this huge integrated system.
Yeah, but it seems like some parts of that system are working a lot better than others, and the analysts on the call were definitely picking up on that, asking some tough questions.
Like what happened with Aetna? That was the big shocker for me. They're talking about potentially ending the year with a loss. After making over $5 billion in profit last year, I mean, come on, what went wrong?
Well, they admitted to some missteps, but the biggest culprit seems to be rising medical costs across the board, but it's hitting their Medicare Advantage plans especially hard.
Right. Medicare Advantage, that's the private insurance alternative to traditional Medicare. A lot of seniors opt for it, but
And CVS seems to have underestimated the cost of those plans, especially with all the benefits they were offering to attract new members.
yeah, some of the analysts were calling them out on that,
Yeah.
saying they were too generous with the benefits without pricing them appropriately. Kind of like offering a gourmet meal for the price of a fast food burger.
Exactly. Eventually that catches up with you, and it looks like it's catching up with CVS now. You've got rising costs, mispriced plans, and then on top of that,
They're facing some unexpected challenges in Medicaid, too, which is the government program for low-income folks.
right. They said the unwinding of those pandemic-era policies is having an impact. Plus, more people are enrolling and they're needing more care.
So it's like the perfect storm for their insurance business.
Yeah, it's a tough situation, but they're not giving up. They outlined a bunch of steps they're taking to try and turn things around.
Like what? What's their plan?
Well, for starters, they're changing the benefits and pricing for their Medicare Advantage plans, trying to rein in those costs.
So basically admitting they messed up and now they're trying to course correct.
Pretty much. But you have to remember, healthcare is incredibly complex. It's not just about numbers, it's about people's lives. So they have to be careful not to alienate members with these changes.
Yeah, they don't want people dropping their plans because the benefits aren't as good anymore.
Exactly. They're also adjusting their individual exchange plans, the ones you buy on the Affordable Care Act marketplace, and they're expecting a drop in membership there too as prices go up.
Makes sense. So they're basically trying to make their insurance business more sustainable.
Right. And they're also shaking things up internally at Aetna, bringing in new leadership, tightening up their risk management processes, trying to learn from their mistakes.
Okay, so trying to fix the insurance side. But let's not forget, CVS is more than just insurance, right? What about their pharmacy and retail business? That's a huge part of what they do.
And that's actually the bright spot in all of this. Their pharmacy and consumer wellness segment is doing really well. They reported record retail pharmacy script share, meaning they're filling a bigger percentage of prescriptions than ever.
So while the insurance side is struggling, people are still filling their prescriptions like crazy. Is that just because everyone's getting sicker and needing more meds?
It's partly that, but remember, they've also been closing underperforming stores. So the fact that they're gaining script share, even with fewer stores, suggests they're getting more efficient.
Right, so it's not just about volume, it's about operating smarter.
Exactly. And they're not just standing still, they highlighted their CostVantage program, which is aimed at making drug pricing more transparent.
Oh man, don't get me started on drug pricing. It's like every time I get a prescription filled, I'm signing away my firstborn child. I have no idea how those prices are determined.
I hear you. It's incredibly complex and frustrating for a lot of people, so CostVantage is trying to bring some clarity to that whole process.
Which I think is a good thing. Anything that makes drug pricing easier to understand is a win in my book.
Absolutely. But it's not all good news. They did acknowledge some headwinds in their front store business. You know, all the stuff you grab at the checkout counter.
Like snacks and whatnot.
Yeah, exactly. That part of the business is being impacted by the macro environment with inflation and all that.
Yeah, makes sense. People are cutting back on those impulse purchases when money's tight.
Right. So we've got pharmacies doing well, insurance is a bit of a mess, but there's more to the story, right? What about their big push into healthcare delivery with Signify Health and Oak Street Health? Are those living up to the hype? Oh, that's where things get really interesting, you know? Signify Health, they specialize in in-home assessments. And then Oak Street Health, they're all about providing primary care, but focused on Medicare patients.
So it's like they're building this healthcare empire, controlling everything from the pills you take to the doctor's appointments you make. That's a pretty bold vision.
It is, but the question is it actually working? I mean, you can have a great idea, but actually executing it, especially in healthcare, that's a whole other ballgame.
Right. And the earnings call gave us some clues. They talked about strong revenue growth for both Signify and Oak Street.
Yeah, which is good, right? But revenue's only part of the picture. The analysts were really pressing them on profitability. Can these new businesses actually help control costs? Especially given what's happening with Aetna.
Yeah, because if they're just buying up companies that are also losing money, that's not exactly a recipe for success.
No, not at all. And that's what I found interesting about Oak Street Health. They seem to be doing well on the cost management front, at least when it comes to Medicare patients.
Really? How so?
Well, they emphasize their focus on preventative care, keeping people healthy so they avoid those expensive hospital visits down the road. Makes sense, right?
Yeah, an ounce of prevention is worth a pound of cure, right? But how does all this tie back into Aetna and their insurance business? Are those just separate pieces, or are they starting to connect the dots?
That's where the integration thing comes in. CVS talked a lot about that on the call. They're highlighting these growing connections between Aetna and these healthcare delivery assets.
So they're trying to create a closed loop. You get your insurance through Aetna, fill your prescriptions at CVS, see a doctor at Oak Street Health, and maybe have a nurse visit you at home through Signify. They've got you covered at every step.
Yeah, exactly. And that's what makes this so fascinating. If they can actually pull this off, it could really change the way we think about healthcare.
Imagine your pharmacy being like a hub for managing your health, with pharmacists playing a much more active role. It's a pretty compelling vision.
It is, but it also raises some questions, right? Can they really manage a system this complex effectively? And what about conflicts of interest? Are they going to push their own services even if there are better options out there?
Those are good points. It's definitely a balancing act for them, and we'll have to see how it all plays out.
Absolutely. But this earnings call at least gave us a glimpse into their strategy, their challenges, and their vision for the future.
A future that could look very different from the healthcare landscape we know today. So what happens next? Where do they go from here? What are they expecting for the future?
Well, they were pretty cautious about giving specific financial guidance for 2025, given all the uncertainty in healthcare right now.
Yeah, that's understandable. But do they give any hints about what they're expecting?
They did. For one thing, they said earnings in their pharmacy and consumer wellness segment are likely to decline next year.
So pharmacies are going to cool off a bit.
Yeah, they kind of have to after this year's record performance. But they're still optimistic about the long-term growth there, especially as their CostVantage program gains traction.
Okay, makes sense. What about Aetna? Are they expecting a turnaround anytime soon?
It sounds like they're cautiously optimistic. They think margins will improve in Medicare Advantage thanks to the benefit and pricing changes they've made.
Well, they mentioned something about star ratings too, right?
Right, the star ratings are like a report card for Medicare Advantage plans. Better ratings mean more money from the government.
So if they can improve their star ratings, that could really help get Aetna back on track.
Exactly. But what about those challenges in Medicaid? Are those going to be a drag on their performance for a while?
Yeah, I was wondering about that.
Well, they think they can eventually get those costs under control, mainly through pricing adjustments. But it's going to take time, maybe a few years.
So it sounds like they're playing the long game here, trying to build a sustainable model for the future, even if it means going through some rough patches in the present.
Yeah, that's the sense I got too. They're focused on efficiency, cost management, all that. But they also emphasize their commitment to innovation, especially when it comes to integrating pharmacy and medical care.
Like what kind of innovation are we talking about?
Think about pharmacists playing a more active role in patient care, providing more counseling, helping people manage chronic conditions, maybe even administering some medications.
So they're trying to break down those traditional healthcare silos, create a more team-based approach.
Exactly. And that could be a big win for patients, especially those with complex health needs who often fall through the cracks.
It's interesting to see how they're connecting the dots, building this more holistic model of care. But it's a big gamble, right? Are they biting off more than they can chew?
That's the big question. Only time will tell. But this earnings call gave us a really interesting look at their thinking, their strategy, the challenges they're facing, and their vision for the future of healthcare.
And it makes you think about, what role should a company like CVS play in healthcare? I mean, they're huge, they're everywhere. It's a little, I don't know, it's a little unnerving.
Yeah, I get that. It raises some big questions for all of us, right? Like, if this model really takes off, what happens to choice? Will we be stuck with whatever's inside these giant healthcare ecosystems?
That's a good point. It's not just about business, it's about how we access care, who's making those decisions for us.
And it's bigger than just CVS, right? You're seeing this kind of integration happening all over healthcare. Insurance companies, hospitals, even tech companies are getting in on the action.
It's like a healthcare gold rush. Everyone wants a piece of the pie.
And it's important for people to pay attention, to understand how these changes might affect them. I mean, healthcare is personal. It's about our lives.
So as we wrap up here, I want to leave you with something to think about. What if, instead of being afraid of this integrated healthcare thing, we saw it as a chance to make things better, to put patients first?
I like that. It's a different way of looking at it. Maybe these systems, with all their data and technology, could actually help us coordinate care better, get more personalized treatments, actually improve people's health.
Yeah, it's a conversation worth having, for sure. And it's one we'll keep digging into here on the Deep Dive.
So if you found this whole CVS earnings call thing as interesting as we did, make sure you hit that subscribe button and the notification bell so you don't miss our future deep dives. We love exploring these trends that are shaping the world.
And we'll be back soon with more. Until then, keep asking questions, keep learning, and keep diving deeper.